Assalamualaikum and hello everyone. Our topic for this awareness video is depression, do not make assumption. My name is Nurujannah binti Rosli and I'm the person who have depression. In front of others, I pretend to be the most cheerful person, always laughing and joking with others, but in fact, when I'm alone, I lost motivated and I'm feeling worthless. But I'm faking it. I try to hide behind a smile to convince other people that I'm okay and happy, because depression is never obvious, it's always complex. The truth is, I cannot admit that I'm sick, so I thought as long as I'm smiling, I must not have depression, because sometimes it's more easier to pretend like I'm fine than open up how I truly feel. There is some people say that depression is fake or otherwise not a real illness that particularly harmful, while they didn't know that we are struggling with depression alone and that is a real battle. When you have depression, you will feel continuous low mood or sadness. Sometimes you may feel low or cry for no specific reason. Second, you're with increasing social isolation because you feel it is very hard being around people. You loss of energy, loss of interest in things you normally enjoy, and the worst thing is can lead to the thought of death and suicide, like it's the only way to escape the pain. Hope. Hope is one of those things that disappear with depression. I don't know how to explain to someone that I want to live my life, but also I don't know how I can. I feel like there is no light at the end of tunnel, but deep inside, I'm seeking for hope and help. I hope there is someone will help me and get me through this phase of depression. I want to live my normal life. I want to enjoy my life again, but how?
Hi Jana, are you okay? 5 ways for parents to overcome children with depression. First of all, parents need to learn and recognize warning signs which is shown by their children, aware of children's mood swings and emotional episodes. Next, parents can help their children by getting them professional help, so as a parent's guidance while handling their children. This way is more convincing than parents handling it alone. Another way for parents to help their children is to give them emotional support. Parents need to spend more quality time with their children, and within that time can encourage their children to have an open and honest conversation. This effort can give parents chances to hear what their children want to say, and also parents need to acknowledge their children in their struggles such as study, emotion, and also in relationship. Other ways for parents to help their children is to encourage them to build a healthy lifestyle. Parents also can involve themselves in this activity, which is exercise regularly, because physical activity can reduce the severity of depression and also known as a good stress reliever. Next, parents can encourage them to eat healthy meals and reduce from eating junk foods and fast foods. This is because foods that we eat can affect our brain. When with healthy foods, it can be a vital way to help reducing stress and coping with sleep. Lastly, parents need to help their children to feel connected. Children with depression tend to lock themselves in their room. Parents can help them by organizing family gatherings for children to meet with their families and feel connected. People can encourage their children to join clubs and school activities to help them expose and live a healthy social life rather than being alone.
Hi, my name is Nur Shahrazati binti Zukri, metric number A169205. I want to talk about the role of friends in depression. Our friends are among the most valuable relationship we gain. We gain in various ways from different friendship. We may talk to friends in confidence about things we couldn't discuss with our family. Our friends may annoy us, but they also can keep us going. That we might to do while helping a friend who suffers from depression or learning depression by their own. Imagine having to educate each person in your life about mental or physical health issue you are experiencing explaining over and over again. It sounds exhausting, right? So you can talk to your friend about their specific symptoms or how they are feeling, but avoid asking them to tell you about the depression in general terms. You also can read up their symptoms, causes, diagnostic, criteria, and treatments by your own. Secondly, you have to be open, welcoming, and listen to your friends. If you are the friend, the most valuable support you can provide is just being there to talk and listen. People really appreciate that their friends have made time to contact them, visit them, and invite them round. It might be difficult for your friend to accept your help, but you have to continue check in with them and let them know that you care about them and you are there for them if they need. Lastly, as a friend, you have to take their feelings seriously. You do not tell them that their feelings are weird or unfounded. Do not try to approach your friends like they are a patient or someone who needs to be fixed. And most importantly, try to be caring, compassionate, and curious, and let them know they are matter to you and you are taking them seriously. Okay, that's all from me. Thank you. Hello?
Miss Dr. Shafika. So today I want to talk about depression. Okay. Firstly, according to the National Health and Mobility Survey in 2019, almost 500,000 people in Malaysia have been found to be experiencing symptoms of depression. Okay, COVID-19 pandemic and Movement Control Order (MCO) also have caused emotional distress to many. Okay, now what is depression? Depression is classified as a mood disorder. It may be described as feeling of sadness, loss, or anger that interfere with a person's everyday activities. People experience depression in different ways. It's important to realize that feeling down at times is a normal part of life. Sad and upsetting events happen to everyone, but if you're feeling down as hopeless on a regular basis, you could be dealing with depression. Living with depression can be difficult, but treatment can help improve your quality of life. You may successfully manage symptoms with one form of treatment. There are several treatments that will be recommended by a specialist. First, your healthcare provider may prescribe medications such as antidepressant, anti-anxiety, or antipsychotic medication. Next, speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy session. Depression is one of the most common mental illnesses to affect teenagers and adults. Many people think that those with depression just need to snap out of it or stop looking for attention. Depression sometimes leads to suicide, which is leading cause of death for young people. So, by raising depression awareness can help defeat the stigma of the illness and can also help people suffering from it to reach out and get the help that they need to defeat it. So I hope with my explanation you can help your friend.